Hi everybody, so the last video I made I set up my feeds. And in that video I said I was going to make a video about setting up IV fluids. So I already hung the bag, which is basically just taking it out of its packaging and putting it on the pole. But I'm going to show you everything else as I talk to you about what I'm doing and why I have a port and what a port is. So a port is a device that's implanted underneath the skin that allows you to put a needle into it so that way you can get medications, IV fluids, whatever it may be. In my case, I only get IV fluids through my port when I'm at home. When we're in hospital, we use it for a lot of other things. We've used it for meds, TPN, a lot of different things. But when I'm at home, it's just for IV fluids, and you access it by putting a needle into the port. That happens around once a week. If you're accessed all the time, that needle has to be replaced once a week. If not, and you're not using it, then you just have to access it once a month to flush it and re-heparin lock it to make sure that the line stays good. So this is what's called a saline flush. This is what we use before we do anything with the port, because you want to make sure that the needle's still in the right spot and that the port's working the way it's supposed to be before you hook it up to things. So you have to prime your syringe. So you just kind of open the top a little bit, pull back on the syringe, and then push up to prime it. Then we're going to take an alcohol wipe and alcohol wipe the end of my line after we take off what's called the end cap, which is this little blue piece. And you just take it off, and then you have my lumen. So then we take our alcohol and we are going to clean the end of my line. So you have to make sure that your line's clean because you don't want an infection, because it would run directly to your heart and it would give you something called sepsis, which could kill you. So you have to be very, very careful about making sure that everything's clean and sterile when you are using any sort of central line, not even just with ports, but with PICC lines, Hickmans, anything like that. So yeah, you just kind of have to go back and forth between cleaning the top and the sides of the line to make sure that there's nothing on it, and that way the alcohol has saturated the entire section that you're going to be using. So when you're done with that, you just kind of toss it off to the side, connect your syringe, and we do something where you just kind of push and then let go. And the reason why we do that is it clears the line better, and not everyone does that. It's just the way that I've been taught to do it, and it makes sure that the line is good. And you do blood return to make sure that everything's in the right spot. You should also be able to taste it if it's going through a central line. I don't know why, but I can always taste everything that goes through my port, including heparin and any medications, like even anesthesia. I can taste everything that goes through my line, which I know not everyone can, but for me, I can, and it's just how it works. This is tubing. This is what we use to spike the bag. I do gravity fluids. Some people use a pump, and it also kind of depends what you're doing. But I use gravity when I'm home. When I'm in hospital, I use a pump, but when I'm home, I don't. It has this little piece right here, which allows you to choose your rate. So you just kind of adjust it depending on how high up your bag is and how fast you want it. There's your clamp. This is the part that connects to the end of my line. This is what spikes the bag. Everything has caps on it right now, that way nothing touches anything, including this, which has a little seal on it. That way nothing gets into the bag. So you just pull that off, toss that little piece off to the side, take the cap off your spike, and spike the bag. There's this little valve over here. We just open it. It allows things to flow better. Detangle your tubing because it always gets tangled. And you take your packaging that you just had and you prime your tubing into it because you don't want air in your line. Sometimes air bubbles get stuck in this part, so you just kind of tap it until all the air bubbles are out because they like to get caught there. And they also like to get caught in the med part, so just kind of flick it for a minute. Make sure there's no air bubbles anywhere. And when you make sure that your line's good and clear, then you put that back down. Now you're left with your prime tubing. So then, take another alcohol wipe. You're gonna do the same thing to the end of your line before hooking up to your bag. So, now we clean the end of my line again, and then we'll hook up to IV fluids. So I do IV fluids for a condition called P.O.T.S. I have a video explaining what that is. Another name that you might hear it called by is dysautonomia, which is the umbrella term. I also run IV fluids because I have slow motility out through my GI tract, which makes it so I can't get hydration through my GI tract. So I'm on 24-hour feeds, which means I get no fluids. So the only way I get hydration is through my port. And because I have P.O.T.S, I don't retain any of the fluid I do get, so it does make it a little bit more difficult to get those fluids in the first place, even if I could run my feeds higher. Once we're done cleaning my line, I toss the alcohol wipe again. And this little end cap on this thing is always a pain to get off. And then you connect it, unclamp your port, and unclamp the fluids. Then you should be able to see it start to drip within the chamber right here, and when you see that, you know that you're up and running and that your fluids are good to go. Now, this is a disclaimer, this is just how I set up my IV fluids, how I've been taught to set my IV fluids up. Might look different for everyone depending on who taught you, your hospital. It kind of depends what you're doing as well, but this is how I've been taught to do it, and this is what works for me. But I thought I'd just show y'all guys what I do because I get questions about it all the time. So thank you for watching.